Gentlemen, let me ask you something honest. Have you ever been in that intimate moment with your partner, feeling incredible closeness and pleasure, but you notice she isn't quite on the same page? Maybe she enjoys the connection, but reaching that peak just doesn't happen for her. Or perhaps it happens occasionally, but it feels unpredictable, like you're guessing in the dark. You're not alone in this. Here's a statistic that might shock you. Clinical data shows that while 95% of men regularly climax during intimacy, only about 65% of women do. And when we dig deeper, less than 30% of women reach climax from penetration alone. That's a massive gap. So here's the million-dollar question. Is there a way to dramatically boost her chances without endless trial and error? I'm Dr. Lila Romano, a board-certified urologist, and I've been working in men's health and sexual wellness for over a decade. I've seen firsthand how these conversations, though vulnerable, can completely revitalize a relationship. When a woman struggles to reach that peak consistently, it doesn't just affect her, it affects your confidence too. Frustration builds on both sides, and sometimes couples simply accept that this is just how things are. Well, here's the incredible news. Science actually has a roadmap for us. Researchers have used 3D ultrasound imaging and thermal cameras to measure exactly how blood flow moves through the clitoral structure in different positions. And yes, some positions make a massive, measurable difference. Today, I'm going to share the 4 best positions for female pleasure, backed by real peer-reviewed research. Stick with me until the end because I'll also share 3 bonus techniques you can use in any position. Before we dive in, let me know in the comments where you're watching from today. I love seeing this community of men in their 40s, 50s, and beyond. For decades, we've been fed a lie. Movies, magazines, and locker room talk have painted this picture that if a man simply lasts long enough, his partner will be satisfied. But here's the biological truth. Most women do not reach climax through penetration alone. Let me explain simply. The vast majority of a woman's pleasure centers are in the clitoris. Most people think the clitoris is just that small external button, but the full clitoral structure extends several inches internally, with 2 legs that wrap around the vaginal canal like a wishbone. This entire structure contains over 8,000 nerve endings, more than twice the number in the entire penis. During arousal, just like your erection, the clitoris fills with blood. It becomes engorged, sensitive, and highly responsive. But in most standard positions, the angle of penetration completely misses consistent contact with this structure. Many of those 8,000 nerve endings aren't engaged during typical movements unless the angle is just right. This isn't about luck. It's about biology, blood flow, and physics. In 2022, researchers used high-resolution ultrasound imaging to track blood flow in the clitoral structure during different positions. They discovered that certain positions increased blood flow by up to 38% compared to standard approaches. That blood flow directly correlated with arousal intensity and orgasm likelihood. Researchers have literally mapped this out. So let's start with position number 4. Now, this may not rank at the very top for raw physical pressure and stimulation, but it's a powerhouse for a different reason. I'm talking about sitting face to face. The biology here is fascinating. Sitting upright allows for moderate clitoral contact, but its real strength lies in something deeper, the close proximity of your bodies, the natural alignment. When you're both seated, creates an environment where intimacy and arousal feed off each other. When she's facing you, straddling your lap, there's natural pressure between your pubic bones. But more importantly, this position offers complete access to the emotional connection. Eye contact, kissing, whispering, feeling each other's breathing sync up. For many women, feeling emotionally safe and truly seen is the gateway to physical release. Oxytocin, the bonding hormone, floods the system during sustained eye contact and skin-to-skin touch, and that hormone directly enhances arousal. Here's how to do it. Try this on the edge of a sturdy bed or a chair with arms for her to hold on to. You sit first, legs slightly apart for stability. She straddles you, facing you, with her knees on either side of your hips or the seat. Both of you are seated upright. Your hands should rest on her hips or lower back, providing gentle support but not controlling the movement. Let her set the rhythm. The motion here is less about bouncing and more about rocking and grinding. She can control the depth, the angle, and the pace, adjusting in real time based on what feels best. This position is perfect for nights when you want to slow things down and focus on the intimacy itself rather than the intensity. It's not about rushing to the finish line. It's about the journey, the connection, and building arousal slowly and deliberately. One of my patients described this position as feeling like they were making love rather than just having sex, and that emotional shift made all the difference for her ability to relax and let go. Now let's move to number 3, and this one is a hidden gem in clinical research. I'm talking about the Coital Alignment Technique, often called CAT for short. If you've never heard of it, you're not alone. It's not talked about nearly enough, but the data supporting it is impressive. The biology of CAT is all about precision. This is a modified version of missionary, but instead of the traditional in-and-out thrusting, both partners shift their bodies slightly higher so that the base of the penis or the pubic bone maintains constant, sliding pressure against the clitoris. It's less about thrusting and far more about grinding in a synchronized rhythm. Think of it like a slow, intimate dance where both of you are moving together in perfect sync. What makes this so effective is the continuous stimulation. In standard missionary, contact with the clitoris is often intermittent, coming and going with each thrust. But with CAT, the pressure is steady and sustained. A 2015 study found that women reported significantly higher arousal and satisfaction with this grinding technique compared to traditional thrusting because the stimulation never stops. It builds progressively rather than in waves. Emotionally, this position creates a profound sense of partnership. It removes performance anxiety because it's not about how hard or how fast you thrust. It's about finding a rhythm together, moving as one unit. Both of you are equally active, equally engaged. There's no pressure to perform a certain way. You're simply syncing up. Here's how to do it. Start with the standard missionary position. Then shift your entire body upward about 2 to 3 inches so your chest is closer to her face and your hips are aligned higher than usual. Instead of thrusting in and out, you're going to rock your body forward and backward, maintaining full contact with her pelvic area. Your pubic bone should be pressing and sliding against her clitoral area with every movement. She tilts her pelvis upward to meet you, and together you find this rocking, grinding motion that feels almost like slow dancing horizontally. I'll be honest with you, this takes a little practice to find the sync. It might feel awkward the first time or two. Don't be afraid to laugh, adjust, communicate. But once you find that rhythm, once you lock into it, the stimulation becomes incredibly steady and intense. Many couples tell me that after they master CAT, it becomes one of their most reliable techniques. Now we're moving into the top 2, and these are the positions with the strongest research backing. I'm talking about the missionary with a pillow. Standard missionary is familiar, comfortable, intimate. But here's the problem. The angle often isn't optimal for clitoral stimulation. That's where this simple adjustment changes everything. The biology here is pure physics. Placing a firm pillow or folded towel under her hips tilts the pelvis upward at about a 15 to 20 degree angle. Ultrasound imaging studies have confirmed that this simple tilt aligns your bodies so that natural movement provides far more direct clitoral stimulation. Instead of your movements creating friction mostly along the vaginal canal, that upward tilt brings your pubic bone into consistent contact with her clitoral area with every motion. A study out of UCLA found that women reported approximately 30% improvement in sensation and satisfaction with this single adjustment, 30%, from a pillow. It also increases blood flow to the anterior vaginal wall, which is where the G-spot is located, adding another layer of stimulation. Emotionally, this position preserves everything you love about missionary. The deep face-to-face intimacy, the ability to kiss her, maintain eye contact, whisper to her. You're solving the physical angle problem without losing any of that closeness. And when she realizes you made this small adjustment specifically for her pleasure, it builds trust and emotional safety. Here's exactly how to do it. Use a firm pillow, not one of those soft, fluffy ones that compress flat. You can also use a folded towel or even a small wedge pillow designed specifically for this purpose. Place it under her hips and lower back, not her upper back. Her pelvis should tilt upward so her knees can fall open a bit wider. Then, move into the standard missionary position on top. The key difference now is your angle. Focus on forward pressure rather than just depth. Angle your pelvis slightly downward as you move to increase that contact with her clitoral area. Her legs can wrap around your waist or stay bent with feet flat on the bed, whatever feels most comfortable. One pro tip: keep that pillow nearby. Don't make a production of it. Just integrate it naturally into your routine. Over time, it becomes second nature, and the improvement in her experience will be undeniable. You can also experiment with the height. Some couples find that a thicker pillow or even stacking two works better based on your body proportions. Don't be afraid to adjust and find what works best for your unique bodies. And now, we've arrived at number 1. According to the research, this is the gold standard. I'm talking about women on top, face to face. Multiple studies confirm that this position produces the highest levels of clitoral blood flow and gives women the greatest control over their own stimulation. When a woman is on top, gravity works in her favor. Blood pools in the pelvic region, increasing engorgement. She has complete control over 3 critical variables: angle, depth, and rhythm. In that 2022 ultrasound study, researchers found that when women could adjust their own angle, clitoral blood flow increased by an average of 38% compared to positions where the man controlled movement. When she leans forward, her clitoris makes direct, sustained contact with the base of your penis or pubic bone. This creates constant rhythmic pressure that most women need. The internal clitoral structure also gets stimulated from this angle because pressure comes from above rather than horizontally. Think of it this way: if you're ringing a doorbell, you want direct pressure straight on, not a glancing blow from the side. Optimal angle equals optimal stimulation. Beyond physical mechanics, this creates a powerful psychological shift. She's in the driver's seat. She doesn't have to hope you find the right spot. She can actively pursue her own pleasure, and that control dramatically reduces performance anxiety. Many women carry invisible pressure to climax quickly. When she's on top, that anxiety often dissolves. There's also incredible intimacy, eye contact, kissing, touching, whispering. She can see you're fully present. Here's exactly how. Lie flat on your back with a pillow under your head for comfortable eye contact. Keep legs straight or slightly bent for stability. She straddles you, facing you, knees on either side of your hips. Key detail: she shouldn't sit straight up initially. Have her lean forward so her chest is closer to yours. This creates the angle for clitoral contact with your pubic bone. Your hands rest on her hips for gentle support, not control. Let her set the rhythm completely. She might start with rocking or grinding rather than bouncing, and that's exactly right. That grinding maintains constant clitoral contact, which builds arousal most effectively. Encourage her to experiment with angles. Leaning forward versus sitting upright completely changes where stimulation hits. Every woman's anatomy is slightly different. As she finds her rhythm, provide gentle upward pressure with your hips, not thrusting, just subtle lifts that meet her movement. Think synchronized support. Here's a pro tip. If she wants more leverage, have her place hands on your chest or hold the headboard. If thighs get tired, she can shift to squatting with feet flat instead of kneeling. If she's not getting enough clitoral contact, try placing a pillow under your hips. And avoid thrusting upward forcefully. This disrupts her rhythm and reduces the contact she's maintaining. Communication here is natural. You can say, "What feels best, leaning forward or sitting up more?" Or, "Show me the pace you want." Watch her body language. If breathing deepens, eyes close, or she increases pace, she's found the right spot. Your job is to stay present and let her lead. Now, no matter which position you choose, I want to give you 3 bonus techniques that work universally. Technique 1, the angle adjustment. Research shows even a half-inch shift in hip positioning can increase clitoral contact by 20 to 30%. In any position, try tilting your pelvis slightly upward. If you're on top, engage your lower abs and tilt your hips so your pubic bone aims higher. It's subtle, but changes the angle completely. You can also try angling left or right. Every woman's anatomy is positioned differently. Think of it like fine-tuning a radio station. Technique 2, the shallow focus. Deeper isn't better. The first 2 to 3 inches of the vaginal canal contain the highest concentration of nerve endings. Instead of deep thrusting, try shallow, focused movements that keep stimulation concentrated near the entrance and along the front wall. When you combine this with consistent clitoral contact, you're doubling the stimulation areas. A 2019 study in the Archives of Sexual Behavior found women reported significantly higher satisfaction with shallow, rhythmic movements compared to deep penetration. Focus on quality and consistency of contact, not depth. Technique 3, the combination approach. Research shows that combining penetration with direct clitoral stimulation increases orgasm likelihood by up to 70%. That's massive. This can mean encouraging her to use her own hand during intimacy. It can mean you using yours, if the position allows. There are also small external vibrators designed for couples that fit between your bodies. Some men feel like using a hand or toy means they're not enough. Let me be clear, that's ego, not physiology. Anatomy simply requires this type of stimulation for most women. Think of it as teamwork, not a shortcoming. Your goal is her pleasure, and if adding direct clitoral stimulation makes that more likely, it's the smart, caring choice. Now, here's the reality. None of this works without communication, but I also know that talking about sex can feel incredibly awkward, especially if you've been together for years and haven't had these conversations before. So let me give you a framework for how to make this comfortable rather than uncomfortable. Timing matters. Don't bring this up during intimacy. Choose a relaxed time when you're both calm, maybe after dinner, during a walk, or winding down before bed. You might say, "I've been learning about ways we could make our time together even better. Would you be open to trying some new things?" Frame it as exploration, not fixing a problem. During intimacy, keep communication simple and encouraging. Ask, "Does this feel good?" Or, "More like this," or "Should I adjust?" Or, "Show me what pace you like." Watch her body language. Breathing changes, muscle tension, sounds she makes, all give feedback. Some couples use a casual 1 to 10 scale where she can say that's an 8, or try adjusting, that's a 6. This makes feedback collaborative. And finally, normalize the fact that this is a learning process. Say something early on like, "We're experimenting together. It might take a few tries to figure out what works best for us." This removes the pressure for everything to be perfect the first time. Now, let me also give you realistic expectations about the timeline, because I don't want you to think this is going to be an overnight transformation. The first time you try one of these positions might feel awkward. You're learning new movements and angles. That's normal. Don't expect perfection. Expect exploration. In weeks 1 and 2, you'll start noticing which positions feel most natural for both of you. This is data gathering. In weeks 3 and 4, the breakthrough usually happens. Movements feel more natural. She's learned to guide the angle and rhythm. You've learned to read her signals. Communication becomes easier. By 2 to 3 months, most couples report significant improvements, not just orgasm, frequency, but overall satisfaction and connection. The anxiety gets replaced by confidence and playfulness. One patient told me, "It stopped feeling like a test and started feeling like an adventure we were on together." Here are a few important warnings. Some positions can be challenging if either partner has knee pain, hip flexibility issues, or lower back problems. Listen to your body and make adjustments. Pleasure should never come with pain. Certain medications can affect arousal, particularly antidepressants and blood pressure medications. If you've tried these techniques consistently for several months with persistent difficulty, see a doctor to rule out underlying issues like hormonal imbalances or pelvic floor dysfunction. And emotional safety is foundational. If there's significant anxiety, unresolved conflict, or lack of trust, these physical techniques won't work. Physical and emotional intimacy are deeply interconnected. So, gentlemen, here's my challenge to you. Try just one of these adjustments this week. Pick the position that sounds most appealing or least intimidating and give it an honest try. Which one are you most curious to experiment with? Let me know in the comments below. I read every single one, and I love hearing how these techniques work for real people in real relationships. I'm Dr. Lila Romano, and I'll see you